Welcome back to the Hot Flash Diaries podcast. This is episode number 11, and we have Dr. Fallis on again. If you recall, he was our guest on episode 9, where we talked a lot about the widgets of health and health span and lifespan. And so he is back again today to discuss all things men's health, as I have a ton of women who ask me, will tell me that they're feeling really well, and now their husband's asking, well, how can I be seen? What do I need? What hormones do I need? So I am currently not seeing men. However, Dr. Fallis is the physician that I refer all of my men to. So who better than to chat about men's health and testosterone? Dr. Fallis, thank you again for coming back onto the podcast.
Oh, thanks for having me, Jessica.
So tell me about men's health, how it differs to women's health. I usually say that I don't treat men because I prefer complex human beings, also known as women, who are puzzles, and I like to put all the pieces together, and men are a little bit different that way. And of course, being a woman, I feel like I connect easier with women, especially being a perimenopausal woman. So I have not treated men at all. So tell me about your practice with your gentleman that you've been looking after for many, many, many years, and how that, of course, differs to women and all the things.
Yeah, so I've been looking after men, not specifically just men, but over the last 5 or 15 years, probably just men. But because I had a basis in family practice and emerged before that, I would see everybody. What I found over time was men are often kind of neglected when it comes to the health system in Canada. Now, not all of that is the health system itself. It's men as well that make that decision. So men aren't great advocates for their health, number one, and they're not great advocates for their disease processes, for example, like cancer screening. Like men still have to pay for cancer screening in this country and have for 20, 30 years, which I think is ridiculous. But that's part of the process, right? Is educating men about general health and wellness and what they need to do to have a long, healthy life, productive life, and what they want to do. So that's, I think, an important kind of a process. And so you kind of start with the basics and kind of build out from there. A lot of men come to me initially because friends or family have told them about me, and they come to Transform Men's Health because they want testosterone. So that's kind of sometimes when the process begins, but it allows us to then talk about important things like cardiovascular health and neurodegenerative conditions and family history and social connections, as well as diet and exercise and restorative sleep and all the important things that we need to touch on in order to be healthy. What's their alcohol consumption? So men tend to have some higher incidence of certain disease processes, and including that in number 3 on the death of men in certain categories is accidental death. So it's teaching guys to be not so crazy and do, silly things, but to be more responsible. And they usually are as they get older. But there's a reason why young men have high testosterone, and it drives them to do sometimes things that they shouldn't be doing, whether that's, drug or alcohol consumption, which is much higher than women. But then there are overdose deaths. 75% of all overdose deaths are men. 75% of all suicides are men, right? So there's incidents of suicidality or attempted suicide, but men are very successful when they decide to do this and killing themselves. We have to be really aware of that. And mental health in men is profoundly important because they hide it from everybody, including themselves. And so I always tell people, dealing with men, you have to learn to deal with, their delay, their denials, their delaying. And when you do that, then you can incorporate them into a system where you can say, okay, here's a couple problems. Let's deal with these right away, and then we can work on other things down the road. It's almost like triaging the healthcare, because you got to hit the important stuff first, and then you can gently nudge them in the right direction. And that usually works. And then they all know that there's a problem. They just don't want to deal with the problem initially, right? So I've got a classic story of men's health, and this is, his wife told me this. She was a nurse, and she said, and he was a very fit firefighter. So he would go out with a very aggressive cycling group every weekend, and they'd go out as a peloton, so there'd be a group of them. And when he went to the front of the peloton and cycle, he was getting this chest pain, right, when he was leading the peloton. And then when he would drop back, as they do, because everyone cycles through your lead position, he would drop back and he'd feel good again. And then he'd go to the lead and he'd have some chest pain. And he came home to his wife and said, geez, it was the weirdest thing. I'd be, riding the lead in the peloton and I was getting this chest pain, but then it disappeared. And he goes, that's odd. She goes, you're an idiot. You're a firefighter. That's a myocardial infarction. You got angina. He goes, that feels pretty good now. She goes, no, you're an idiot. You're going to the Emerge. Let's go. So she took him to the Emerge. Of course, he did have angina. He ended up having, bypass grafting and stents put in. And then he did great. But it's a classic story where that was troublesome. But then as soon as it's gone, it's like, it seems to be all right now. I'll just ignore that. So that's classic men's health.
Yeah. And again, very similar, as I was sort of chatting with you off podcast about my brother. He'll be fine with me sharing this story, but same thing. He was having this exertional anginal pain for, he says, a while. That in men speak is like at least 6 months to a year.
Yeah.
And didn't think it was anything. He thought it was anxiety. There was lots happening with our mom. So I appreciate, maybe it was anxiety. But when I'm there watching him exert himself and having chest pain, you need to be seen. So calls the family doctor. Actually, I think it was his wife that called and booked him in. The first available was January, and this was back in November. I'm like, you might want to be seen a little sooner if it happens again. But good enough, at least he knew when the pain didn't go away, it was time for him to go to the hospital. And thank God he did. Otherwise wouldn't have survived. For sure. I mean, women, we have chest pain. We're in the doctor's office the next day. We're very in tune with our bodies. And we understand that when something like that happens, not everyone, that's a generalization. There are some women that aren't, but usually it's because of denial, right? That you just don't want to know what's going on. But really, most of us are pretty good about seeking care, whereas men are not. And it's not uncommon when I've practiced in or covered for family docs where a wife or a girlfriend or a partner will come in with said male to sort of give the true history of what's going on, because they tend to downplay things, right? And everything's fine. I feel fine. There's no problem. When in actuality, there's a lot happening. So I like that approach of dealing, almost triaging the most acute health concern, dealing with that and saying, but let's do short-term follow-up and see how you're doing, and then tackle some other preventative health, things that need to be looked after.
Yeah. Is that delay, deny, and deflect.
Yes.
That's what they do.
Yeah.
So
yeah.
we got to address that. And you can. And once you do, they're great, but you got to get them in the door initially. And so whatever way that is, then you can just start the process and just keep working away at things, keep working on the widgets of wellness, with them. And they get it. It's just, and the other thing with Transform Men's Health, because I'm all virtual, I can look after men all over Ontario now, which is fabulous.
Amazing.
And men love virtual medicine. And they love virtual medicine because they can be in the fire station in Toronto, they can be in their work truck, in a parking lot, they can be at home, they can be at the office. They don't have to drive to the office, sit in a medical office with screaming children for 20 minutes to see the doctor for 8. They hate that. So to be able to sit down in a relaxed situation where we can have a good conversation in a secure and safe place where they can talk about concerns that they have, erectile dysfunction or sexual health concerns. They feel comfortable where they've put themselves. We can have those conversations easily, and then I can direct, labs or whatever else they need to get done, and then we can reconnect again. They love virtual medicine. They hated the old way we used to do medicine with family practice, where they drove to the office and sat there with screaming kids. That drove them crazy. But anyways.
No, it's not better. Convenient. And certainly this is a good way to, be able to be seen more efficiently, but also you're not exposed to 40 different viruses when you walk into a family doctor's office or a walk-in clinic. So it's really convenient. And it's the same with my women's health practice as well. And women love it. I have tons of first responders as well. And, I see them in their ambulance or whatever.
Yeah.
doing their little FaceTime with me at lunchtime. And it's fantastic because it's just that accessibility piece is huge. And it will inevitably get people the care that they want and need versus, putting it on the back burner because they don't have time to make it in between 9 and 5 or, 12 and 3 or whatever the doctor's offices are. So it's really that level of convenience is just incredible. So that's amazing.
And the technology is there to support it. I mean, we get lab
Exactly.
tests back, and I see the lab tests. I send it to them so that they've got a copy as well. And then I send them a link so they can book an appointment so we can talk about it. I mean, it all takes, minutes. It's so much
It's
more
incredible.
efficient than, I'll call you if anything's wrong. Well, that doesn't work for everybody, right?
No,
It's not great. And this is one of the areas of men's health is one of the areas of medicine that you can actually do virtually. You can't do all. You have to have hands-on medicine, but
for sure.
mental health, a lot of men's health, you can do, virtually. You don't have to do it, hands-on.
Yeah, no, it's
So,
great. So with women, of course, we replace several different hormones, right? We've got our progesterone, that is usually the first one, then the estrogen and testosterone as well. And thyroid is also a big concern for perimenopausal women. About 20% of women become hypothyroid
really,
or have
wow.
or have a thyroid that's just not functioning optimally anymore. So thyroid replacement is not something that is usually looked at in sort of the conventional medicine standpoint. Again, that's the functional medicine piece that's so different. We
Yeah.
look at all of the hormones. But with men, tell us a little bit more. We know that testosterone is really the main one that's replaced, but there's also other hormones like DHEA that you talk a lot about and the replacement of that. How does a guy know if his testosterone is low, if his DHEA is low? What is DHEA?
Okay.
Fill us in on that because
Sure.
a lot of people don't really know what that is, and men certainly have never heard of some of this stuff. So yeah,
Yeah.
give us a little
So
overview.
testosterone is, I think, one of the most important hormones in the male body. It's in every cell. It affects every part of their life, whether it's muscle mass, strength, red blood cell production, fat distribution, libido, sexual function, sperm production, mood regulation, cognitive function, sleep, energy, confidence, motivation. It affects all of those things. So testosterone is really important for men. The problem is, unlike women where they get like that profound drop off of hormone, where they know that they're perimenopausal and they certainly know when they're menopausal at, 51.3 or whatever the average age is approximately. For men, it's very slow and insidious. So from 30 on, testosterone drops in men about 1.6% per year. So a lot of times it just slowly chips away, goes lower and lower and lower over time. And so I often get guys in the 50s and 60s come to me because they've had 20 or 30 years of testosterone dropping, and finally they start getting symptoms. So low testosterone is problematic, and there's a lot of men out there that have low testosterone that don't know it because they never think about it because it's so slow. But then sometimes they'll put it together. Their friends will tell you, or their wife will tell them that, what's wrong with you? Because they get that kind of grumpy old man scenario, right? We've all seen these grumpy old guys where they're irritable with everybody. They're falling asleep in the afternoon. They can't sleep at night. They're getting fat around their midsection. They don't want to go to the gym. They don't want to have sex with their spouse. They can't put on muscle. In fact, they're losing muscle. They've got brain fog. They're anxious. They're nervous. They've got some depression. They may have erectile dysfunction, but most importantly, they're tired all the time. That's a guy with low testosterone, right? So when I tell guys, I said you can have numerically low testosterone, but I've got guys who are in the high teens that are running half marathons. We won't treat them. We'll leave them be. Why would we treat that? But there's some guys, especially when their testosterone is below 20 and certainly below 15, where they usually start getting some of the symptoms. And it's the symptomatology that usually brings them to me. They feel past their prime. They feel tired and worn out like an old man. And that's because in a lot of cases, their testosterone has dropped to such a level that they don't get the vitality that they had when they were in their 30s, right? So I tell guys, I mean, we don't have to treat this. You can carry on doing what you want to do. We used to call this, you're just getting old. Well, yes, but when we get old, we also, get eyeglasses, to repair that, to replace that, to improve that. Same with testosterone. If we want to try it and see if it makes a difference, we'll put guys on testosterone, whatever we want, whether it's a gel or a cream or a nasal gel or an injection, to see if it makes a difference for them. And most of the time it does. The other thing that I found really interesting, actually two things. Number one is I get a number of men that come to me with depression, and they've been on 4 or 5 different antidepressants, and none of them work very good until you correct the underlying low testosterone. And once you've done that, then usually the depression gets better, or the anxiety or nervousness, and they can either lower their antidepressant or sometimes get off it altogether. That is transformative in a life. When you can, somebody who's been struggling with mental health for years, and they just keep trying different, SSRIs or SNRIs to try to get their mental health better, and it doesn't work, and then you put them on testosterone, and in 2 to 8 weeks they feel like a new person. That's transformative, and that's rewarding as a clinician as well. I know
For sure.
you've experienced that as well. So that's important. So I think it's that mental health picture that we sometimes forget about, and that's really important for it's physical, sexual, mental, and emotional well-being. It's quality of life that we're trying to
For sure.
get that vitality back. And testosterone for lots of men can make a just unbelievable transformative change in their lives.
Well, and it's interesting that you say that in terms of the sleep and also the mood control, because I find that a lot with women. And when we replace progesterone, it's a similar effect. The highs and lows are not as impactful anymore. They feel a little bit more stable. They're feeling happier, sleeping better, all of those things. And that is in and of itself so rewarding because it's life-changing for people, like absolutely life-changing. And, in addition to all the other things that we're doing in terms of the movement and everything else, of course, which is hugely important. One pill's not going to solve the problem, or a gel or an injection is not going to solve everything. Nope. But heck, if it's a big part of it and you can replace it quite easily and safely, then why not? But that's the other thing I wanted to mention is, testosterone, you don't hear about, contraband estrogen, like that's not really a thing. There's no real black market. Maybe there is, and I'm just oblivious to it, but no one's selling estrogen on a corner or progesterone, although I think they should because it works so well.
Yeah, that's true.
I feel like progesterone should be in the water. But anyway, but all jokes aside, testosterone has really had a bit of a bad rap, right? I mean, there's lots of black market testosterone, like gym testosterone, that's gotten, this sort of gym rat sort of reputation. And so the thought of taking testosterone for, average, Bob and Joe who, just have a mild low testosterone, all of a sudden it's like, oh, is this something I should be taking? And there's just bad press on it, right? When we know that you can actually replace it so safely in a controlled environment. So tell us more about that, and when a patient or perhaps a spouse of a patient might be apprehensive because of the bad press on testosterone.
Yeah, that's a great question, actually. So I think the important thing is to know that when I prescribe testosterone, buying it at a pharmacy, it's a pharmaceutical grade product. They buy it at a pharmacy like every other medication that they get. It's monitored. It's Health Canada approved. And my job is then to follow up to make sure that you get all the benefits and none of the drawbacks of it. That means improving things to get back to the 80 or 90th percentile if we can get there, where guys are feeling great and none of the side effects. And there's side effects with every medication, including testosterone, but it is not testosterone bought out of the trunk of a car from your gym buddy. It's not that. I mean, all of those. I mean, a lot of those are animal products that they use in humans, which is problematic. And I have a lot of guys who have been on anabolic androgenic steroids, so AAS. And for performance, they've used it for performance enhancing, bodybuilding, et cetera. And they come to me to correct the problems that they've created over their multiple cycles of abuse of anabolic steroids and other things that they use for performance, including infertility, you know?
Exactly. I
So
was
there's
just going to
so
say the
many things.
side effects of that.
It's very problematic, but take people when they come to you and they need help. You try to improve the situation and get them doing it safely and
Hmm.
effectively. It may not be the performance enhancement that they want, but that's not what I'm here for. I'm here for
Exactly.
improving, lifespan and health span. And if you want to do the other, then don't come to me. I won't be part of that. Right.
Right.
So
Well,
yeah, but it's
and that's
important to
the
know that you can do this safely and you can do it safely. It's been around for decades. And we know that the safety factors, we know that it's had bad reputation also, just because of bad research and bad documentation of that research. So we know that it doesn't increase your risk of cardiovascular death. We know that it doesn't increase your risk of prostate cancer. We've known these things for decades, but the old research, the old stigma is still there. So sometimes the family docs and the endocrinologists will sometimes say things that aren't actually true because they haven't actually followed the literature in the last 20 years. But very safe if you do it properly and it's monitored properly. And we know that guys who you've normalized testosterone have about a 30% reduction in cardiovascular death and about a 40% reduction in all-cause mortality in some studies. So it can be incredibly beneficial, but you have to understand, how to do it and what to do it, what to do with it, so that you can get the benefits. Uh,
Well, it's interesting that you mention, the poorly documented studies that have affected, of course, the Women's Health Initiative was
yeah, oh, yeah,
incredibly detrimental to women's health and has been
yeah,
for the last couple of decades. But I imagine that there was some collateral damage to the men's health side of things as well, because hormones in general were just labeled as bad. They were
yeah.
causing cancer. They're going to give you heart disease and strokes and heart attacks, all the things. And of course, we know so much more now. Unfortunately, the voice isn't as strong as it was back then when it scared everybody. And although everything's been disproven, in fact, we know that it doesn't cause breast cancer. What we know is that if you're predisposed to breast cancer, perhaps your breast cancer will be detected faster, which means that the mortality rate is actually a lot lower. So it's just such misconstrued numbers and evidence. And so we know so much more, but I can only imagine that men, unfortunately, also felt a huge effect on in terms of hormonal health and replacement of testosterone in a safe environment as a result of these studies as well.
Yeah, one of the most common questions I get asked by women and men when I'm putting men on testosterone is about roid rage. And I
Yeah.
said, roid rage does not exist. It doesn't happen in testosterone. If we're doing this properly and bringing you back to where you used to be, within that normal range, but at the top of the range, there's no roid rage associated with. In fact, most women say, "Thank you for giving me my husband back." Because now he's a kind, compassionate individual. He's not grumpy with everybody all the time. And all of a sudden he's how he used to be, loving and kind and empathetic and emotional. And that's what you like to hear. You want to get them back. And I always tell people we treat the patient, not the lab test. So lab tests are helpful. They guide us in what we do, but you always have to listen to the patient because the patient knows their body better than anybody else.
Just it. That's exactly how I practice as well. The hormone panel for estrogen and progesterone is not really that helpful. I listen to the patient's symptoms and treat accordingly. So that's the most
Yeah.
important. So that's good. Yeah. So healthy and much like, with women's hormones as well, you're not trying to replace back to when they were 20. We're replacing back to a healthy, sort of range, right? Like early 30s, late 20s, and that range where you're just feeling good. Your cells are healthy. Your brain is like the neurons are firing appropriately.
Yeah.
That's really what it's about. It's not about overdoing it and going back to when you were a teenager. Nobody needs that level of testosterone
No, nobody needs
at
that
all.
level.
Having two teenage boys, no thank you. So yeah, we want to keep it at a nice healthy level, and that's really what it's about. Again, testosterone, much like all the other hormones, are highly anti-inflammatory. So there's no
Oh yeah.
surprise that
Oh yeah.
when we optimize it, you're helping things like heart attack, stroke, neurovascular disease, or neuro diseases, all of those things as well. Because again, we're reducing that inflammation that really does cause aging, right? We're trying to prevent that from happening. Again, it's
Exactly.
all about that. So
Exactly.
yeah.
Yeah. I always tell people that almost every disease process in the human body has either a lack of blood supply and or inflammation. So we're always kind of working on both of those to try to maximize blood flow and reduce inflammation. And so we do that. Hormones are one way we do that. Supplements, appropriate supplements are really helpful with that. Diet is important with that. Exercise is important with that. Restorative sleep is important with that. So there's always like a little bit of everything you have to do, not just one thing. And that's the same for men's health and TRT and whatnot as well. The nice thing about testosterone, it does affect everything. So when you start treating guys, all of a sudden their sleep's better, their sex drive's better, their mood's better, their motivation is better, their cognitive function, they lose the brain fog, their muscle strength comes back, they get better exercise recovery, they can put on muscle mass again, which we know in longevity studies is really important. Bone health is better, erectile dysfunction is better, vitality and energy is better. And the other thing that they get is you get a shift of fat mass to muscle mass. So about 3 kilos, 3.3 kilos, where you can lose fat mass, but you'll put on about 3.3 kilos of muscle mass. So you get a
Amazing.
transformation over time, like this over months, with appropriate exercise. But it can be transformative in that regard as well. So there's lots of benefits with regard to testosterone. And as just taking off on one of your points about sex drive, I always tell guys, make sure if you're 60 something and you and your spouse have got used to a certain sex drive accommodation, this may change. So make sure she's part of the conversation too,
Yes.
so that she's aware of what's potentially going to happen, because she may or may not want that, right? So
Yeah. She may
it
be okay with a
deserves.
low sex drive, right? And then you come home and all of a sudden you're like ready to rock and roll and you're not on the same page. So yeah, it's good to have
No,
that conversation for sure.
it's important.
Especially if it's been like that for 5 or 10 years.
Exactly.
Yeah. Yeah. No, that's great. Now tell us a little bit about, so two more questions I wanted you to cover. One is what DHEA is and how you use that in your practice for men. But then
Okay.
also what happens with men who are still hoping for children, who are, perhaps they're in their early 30s and they still haven't had all of the children that they'd like, or maybe none at all. And they're thinking that down the line, they may like some to have children. How does testosterone replacement play a role in that? And what would you do in that case?
Okay. So DHEA is a precursor molecule for production of testosterone and estrogen. So if you don't have the building blocks, so DHEA is the building blocks to create testosterone. So I always check the DHEAS marker in the blood when I get guys coming in as an intake to find out what that is. If it's low, so normally I like it around 8 to 10, ideally. If it's low, like 2, 3, or 4, often we'll put guys on DHEA to try to build that up so they've got the building blocks to actually produce their own testosterone. And we'll often do that in young men because that's an easy thing to do. It might bump their testosterone a little bit for them, and they'll sometimes feel better with that. It also is really important for sex drive libido. So the DHEA is important for that. So sometimes just for that reason alone, I'll put it in. Now, it's difficult to get in Canada. That's the problem. So guys either have to buy it the next time they're over, in the United States, visiting someone or on vacation. It's sold over the counter in the United States, but in Canada, we have to get it compounded. So there's level 3 compounding pharmacies in Ontario that will make it up for us for the guys that need it. So that's the DHEA. With regard to downsides to testosterone, there's basically 4. Number 1, once we start treating, we're obligated to keep treating. So if someone has a testosterone of 9 and we start treating, we get him into the 20s, and he says, you know what, I don't want to do this anymore, he can stop, but his testosterone will just drift back down to 9 again, right? So That's one obligation that we've got to keep treating once we start. Number two is it always affects fertility. So usually eliminates men's fertility within about 6 months. So we're very reluctant to put young men on it, although we do, usually with some support of HCG or Pregnal or things that we can use that will help protect sperm production and intratesticular testosterone production. So that's important. Then third is I always tell guys that there's a potential you can get shrinkage of the testicles over time. About 20% of guys will get that. So that's important for some, but not for most. But at least they deserve to know that. And then number four is we have to monitor this, right? If we're going to do this properly, testosterone is still a controlled substance in Canada. We need to give it to you, but we need to make sure that you're getting all the benefits, not the drawbacks of it. And the drawbacks are often it will increase red blood cell production, hemoglobin, and hematocrit. So those are things we need to keep an eye open to make sure that we monitor those. They don't go too high. They don't usually if we do it properly, but they can. So you got to keep an eye on things like everything in medicine. You should be monitoring things like blood pressure, right?
Right. Exactly.
So yeah, so those are important. Now, what's really interesting is that when I started looking after guys, especially for TRT, it was almost all 50, 60-year-old guys. I am blown away how many young men I'm seeing with astoundingly low testosterone levels and infertility. And when you look at the literature across Western Europe and North America, there is a huge decrease in male fertility over the last several decades. Nobody has any idea why. Nobody has any idea why the testosterone in young men is plummeting. Is it microplastics in our environment? Is it pesticides? Is it food? Nobody knows, but we need to still sort this out over time. But it's astounding how many young men I get coming in. And so that leads to another problem is they'd want to have families. Their testosterone is so low that they're struggling with life, but you still want to maintain fertility for them as well. So that's a bigger challenge to do that. It's not impossible, but it's a bigger challenge.
That's good to know. I mean, at least there's options, right, in terms of what you can do. And now DHEA wouldn't affect fertility.
No.
Perfect. So that could be a starting point.
Yeah, and then sometimes we'll just put people on HCG, which is human chorionic gonadotropin. So it's off-label. It's usually used for women, as you know, but we use it for men because it tricks the body into trying to increase production of testosterone. So sometimes but it also maintains sperm production at the same time. So you get the benefits of still producing sperm, still having, your testosterone, and actually you'll get a little bit of a bump, usually 20 to 30% of the testosterone will bump. So that's helpful as well. And sometimes you just do that to start and see how you go. Often we do semen analysis before to see where they are. So we can, if they need to do it later on, we know where they've been. I've got a number of men I've had who have been on in the past, in their teens, 20s, early 30s, and then they find someone special and they decide they want to have families, and they've mucked things up because of what they've done to their bodies with the hormone adjustments they've made over their teens, 20s, and early 30s. But I had 5 last year that we were able to allow them the opportunity of having a child with their spouse. So yeah, we didn't know how it was going to work out, but 5 out of 5 of them last year were successful. So that means that, just because they've messed things up doesn't mean you can't, get it heading in the right direction again. So.
Well, our bodies are really all about healing themselves, right? It's really miraculous what our bodies can do and how much insult and injury they really take on a day-to-day from
truth. No kidding.
Right? It's true. And like you said, even from environmental, pollutants and all the things that we're exposed to, and yet we still heal. And so it's not surprising. And how many men you would know because you were part of the non-surgical vasectomy physician sort of group, how many men have a vasectomy, then they have a second relationship and all of a sudden decide, oh my goodness, now I'd like to try for a family again. And reversals are they don't have a very high success rate, but they do work, and so our bodies just heal themselves,
Yeah.
Just like women who have tubal ligations and all of a sudden they're pregnant.
Yeah.
It's pretty amazing. You never know what your body is doing in behind the scenes, but it always wants to heal itself. So, well, that's great. I think this episode has been able to provide some information to women to share with their husbands. Hopefully their husbands and male partners are listening to the podcast itself. I will put all of your information for Transform Men's Health on the show notes so that they're able to connect with you. And of course, all of the gals that I see when their husbands need to see somebody, you're the person I send them to, because I know that they're going to be well looked after. But it does provide a bit of hope. Of course, there's nothing worse than one partner in the relationship feeling fabulous again and then the other one still feels awful, right? So if we can help them both and to feel great, then I think that's we're miles ahead. So thanks again for everything.
So too. Absolutely. Yeah. It was great seeing you again.
Great seeing you. And I wish everyone who's listening on the podcast today to have a fabulous day. And we're going to be back in just a couple of weeks with our next episode. So thanks again for tuning in, and all the very best.